So thank you so much for joining me today. My name is Dr. Becky Rucker, and I'm going to be presenting today on coaching your client out of low back pain. So as you know, there are many people that have low back pain. They're saying now that 8 out of 10 people are going to experience low back pain at some point in their life, and almost 700 million people currently have low back pain. So I really want to do a deep dive into coaching your client, looking at movement patterns to get you to be able to get your client out of low back pain. So first, a little bit about myself. My name is Dr. Becky Rucker. I am a doctor of physical therapy. I also am board certified in orthopedics for physical therapy, and I have my certified strength and conditioning specialty certification. I also own Physio Movement Performance in Tacoma, Washington, and I have an amazing team of 5, and we're about to add another physical therapist, so super excited about that. In our clinic, we specialize in orthopedics. I also have a background in Pilates, so I have both a rehab and fitness background in Pilates. And I've done more work involving higher level fitness and strength, kind of working with both barbells, kettlebells, just kind of the whole gamut. Our clientele range from lower level foundational to your high school athlete, your weekend warrior, all the way up to some professional athletes too. And in terms of our treatment style, we obviously with Movement My Name, movement analysis and movement exercise is our biggest focus, but we also do hands-on work and other things like that. I feel that the hands-on work is an integral part of getting somebody to unlock before we start to build them up with the exercises. So first up, I want to start with Jessica's story. So Jessica was a client of mine who came to me with low back pain. She had been in pain for many years, but over the past few months or so, she had been getting increasing back pain. And Jessica said at that point, I've tried everything, including going to another physical therapy clinic for 3 months, the past 3 months, and she had felt no change in her symptoms, and she was feeling pretty depressed at that point. On top of that, she had just gotten an MRI, and the MRI showed in certain areas of her low back some moderate arthritis, and she was feeling just really helpless by the fact of the MRI and really worried about her future. Would her back hold up in the long term? She was in her late 30s and felt like she had a long span to be able to live life, and she didn't want her back to continue to get worse. So I'm going to tell you a little bit about Jessica first, and then we'll talk more into how we assessed and moved down the path. Jessica was in her late 30s. She had a couple young kids, and because of the back pain, she wasn't able to play with them. She wasn't able to give her daughter a bath. Just that leaning over and bending position really bothered her back. She also had a desk job, and the desk job was sitting all day, okay? And she felt that she had to take a lot of breaks because sitting was really hurting her back, and that was decreasing her overall productivity and also making her more angry as her back got tighter as she sat during the day. The final thing I'm going to tell you about Jessica, she loved to work out, she loved to exercise, but she wasn't able to do what she'd once had done. She wasn't able to go to the workout classes and do the plyometric and lift the heavier weight because she was worried about her back, and every time she felt like she did it, her back pain would get worse. So Jessica was still doing a little bit of workout, but she had gained a little bit of weight, and she really wanted to get back to working out and having that both on the physical and mental, emotional side. So Jessica, we ended up evaluating Jessica, and I'll tell you a little bit about what I found. I found some of the normal things. I found a little bit of mild hip range of motion issues, mid-back issues, core strength, hip strength. All those things were minor though. The 2 main things that stood out to me in Jessica's story was the fact that she, number 1, was moving in these certain exercises in a way that was not optimal for her body. So her movement patterns were contributing to her pain. And we'll talk a lot more about that later on in our presentation. That's what I'm going to dive into. Number 2, Jessica did not move her back at all. I asked Jessica actually to reach for her toes, and she reached down, she got down to about mid-shin, but she did not bend her back at all. She hinged at the hips, and she just kept her back very quiet, meaning very still, the whole time that she moved. So I got a little curious about what was going on, what she felt. I asked her, can you reach a little bit further down to towards your feet? What's stopping you? Can you round your back? And Jessica looked at me and said, I'm afraid it's feeling tight through that region. And then she said to me, but I thought I was never supposed to bend my back. And she used the word never, and you could tell that for a long time she had stopped using or bending her back or moving her back. Okay, so I'm going to stop her story right there for a brief moment and ask you, what do you think? Should a client always keep a rigid straight back, not flex, not extend? No. I hope you answered no. Our spine is meant to move, okay? So, we have all these vertebrae. They're stacked on top of each other. They're meant to create this articulation, this bending forward, this bending backwards, this rotation, different positions, okay? Obviously, in the case of somebody that has significant pain, we may limit it in the short term, but we're going to progress them back to moving the spine. Again, I'll talk a little bit more about that. So let's get back to Jessica's story. So we started treating Jessica. We started the normal kind of rehab stuff, which is going to be, again, that hip mobility, mid-back mobility, core strength. But the main thing we focused on in the beginning was those movement patterns with certain exercises like bridging or an RDL or something like that. We kind of like started on that movement pattern path. And from there, we started to slowly, as she started to feel better, integrate in some spinal flexion, some rotation, things like that. And fast forward to 6 months later, Jessica was back to working out. She was doing plyometric work at the gym, this woman's gym that is an amazing place in our area. She was able to play with her kids. She was able to give her daughter a bath, and she was actually sitting longer for work without having to take so many breaks. So Jessica felt amazing. She was happy. We had given her back her life. Takeaway number one. So I'm going to give you 3 takeaways from this story that I want you to really take into it. And our main takeaway in our main presentation will be based off takeaway 2. But I want to say the takeaway number 1 is really that our spines are meant to move, even when we have low back pain. And I'm going to say especially when we have low back pain. As I mentioned, we may limit in the short term if somebody is having severe low back pain, acute issue. We may limit the motion during that time, but our goal is to restore that natural spinal mobility and to be able to get them feeling confident in moving and being able to pick something off the floor, and their back rounds as they pick it up the floor. So as we all know, the spine is meant to move. Make sure your clients know that they're not always trying to brace and hold that position. Again, when we brace, when we hold the spine all the time, it's going to create this compression. It's going to create more tightness, which then leads to more back pain. Okay. Again, when we come to something like heavier lifting, we are going to do more of a straight back, but overall, our body needs to learn how to move, both with fitness and also in just everyday life. Okay, on to takeaway number 2, and this is the majority of where our presentation will be going, okay? There are no bad exercises. I'm going to repeat that. No bad exercises. Only suboptimal movements for that person. And I say suboptimal movements for that person because every exercise is going to have a different effect on a different body. And everybody is going to do an exercise slightly different. Okay, but we need to look at them and go towards this midline. So today we're going to be talking about movement and looking at many different movement patterns and how to start coaching that. Okay, movement patterns that affect the low back, what we're going to be looking at today include excessive low back extension. Okay, many people think that rounding the back is like the worst, we get disc injuries, things like that. And it is an issue in many cases, but I often see that excessive low back extension is actually more of the issue. So that's going to be the primary focus of most of our stuff. Then we'll talk about hip disassociation. What does hip disassociation mean? It means, are we able to move our hip like without pulling our pelvis and our spine into either flexion or extension, or even side to side, up and down, okay? We want the hip to be able to move independently in the joint from the pelvis. And then finally, the movement pattern number 3 we're going to talk about is like minor, we'll do just a couple things that talk about low back flexion or flattening. And in that part, abdominal glute disassociation, meaning can you engage your abs without the glutes also working in that? And then when glute work is good, but sometimes glute work is too much. So sometimes we want to take the glutes out of it, and we'll talk about that too. Okay, so the low back, here's just a picture of our low back. We have curves for a reason. The curves are in our back to give us shock absorption. So do we want to always flatten our back? Do we want to have this rigid military posture all the time? Do we want to be tight all the time? No, we don't. Okay, so we're just going to talk about that. But we see, and I'm going to just use my little cursor here, that we have this natural curve to that low back. And we want to have that in many positions, okay? All right, so extension. Extension is good, extension is normal. Just like we talked about with flexion being good and normal, extension is also normal for the body and good. However, if we get into a situation where we have excessive extension, this can lead to painful impingement of the nerves, and it can also lead to compression of the facet joints. Okay, when we pinch the nerves, and we'll use my little cursor here, nerves come out of these little holes here. Okay, when we extend back, those holes close down a little bit more. And then the facet joints right through here, those also can get compression to and create pain also. Okay, so when we go into excessive extension, if we don't have the mobility in our body to do this or the strength to control it, we can get, again, that pinching or that pain. So we're looking at like both cases of like total motion. If somebody is going in excessive extension or really, really far back, that may create an instance of pain. However, the main thing we're going to looking at is repetitive movement. Even if there's subtle, repetitive, excessive extension positions, we're looking at that. Okay, let's talk about two primary reasons for suboptimal movement, okay? The main thing, again, that we're going to be addressing today is movement patterns or movement and how somebody's moving that is more optimal for their body. So, for instance, we may have like if we're doing a bridge, we may have a less than optimal use of the glutes and hamstrings to kind of tuck that pelvis at the top. And we may have also more issues with the abdominals or the rib cage controlling that. And that may be something that the person is not really aware of, and we need to bring awareness to. Okay, so it can be motor control and that their brain just doesn't understand it, or it can be a little bit of a strength issue too. Okay, typically it's really an awareness issue, and then we build strength on top of that. We can also have a short muscle limiting motion, and we'll talk about this in some of the videos I show you. That would be where we have short, for example, short hip flexors or tight quads. So when we go up into a bridge, our back actually naturally is going to try to go into more extension because our hip extension is limited. So I'll show you in the videos both of these, but the main area we're going to focus on today is those movement patterns. Okay, let's get into this. Okay, these pictures also are going to be showing you a little bit more of this extreme position just because I want you to be able to really see it. But you're going to get good at looking at lots of different people and lots of different patterns because it's going to be, in some people, much more subtle. But the more you watch, the more you start to give awareness to your brain of what is right and what is wrong for that person. Okay, so when we do bridging, we really should, and we're looking at it in a way that we're trying to protect the back or make the back stronger in a gentle way. We really should not feel anything through our back. Okay, this is not, it's a back exercise in that the little muscles should be working while we're hinging at the hips, lifting up and down. But the big muscles should not be overly working, okay? Our rector spinae are the big muscles, multifidi little muscles. The rector spinae should not be gripping, and we'll talk about this. So here we show this position where this client, this is actually Maggie, one of our awesome team members, she is going into excessive extension. We see a hinge point right in her back. So that's creating some compression in her low back. Okay, so why is this happening? Okay, number one, we see this rib flare, which is often the case with like the upper abdominals or the abdominals just not really controlling that rib cage position. We also, she may not be fully doing at the top of that bridge, tucking the pelvis or getting that posterior pelvic tilt. So let's look at this video right here. Okay, again, we see that rib flare there at the top, and she doesn't look like looks like she's using her glutes hamstrings obviously to get up there, but she doesn't look like she's getting a tilt at the top. Okay, so we're getting again that extension right through that low back. All right, let's go ahead and go on to I'm going to coach her here. Okay, so I'm having her bring that rib cage down or closing that canister. We're hinging at the hips, releasing the glutes on the way down, and at the top she's going to really tuck her pelvis. Now I'm coming in, I came in, and I'm going to use my hands. I don't do it anymore in this video, but I often go in and I really help them feel that tilt at the top. Okay, so they really get that full posterior tilt at the top of the bridge. We don't want it at the bottom of the bridge. We're the bottom of the bridge, we want this nice hinge and opening, but the top of the bridge we want tucking. So two things to think here are going to be, I usually tell people abs and glutes. Okay, thinking abs and glutes at the top of the bridge, and then hinge, release the glutes on the way back down. Okay, so I brought in, this is one of my only videos of a real client here, okay? But I'm just gonna show you that this is a much more subtle pattern in here, and you may not be able to see this right now. It's harder to see on video, but in person, as you start to get more aware of what should be happening and where they should feel it, you're gonna start to see these patterns. So number one, we're gonna watch this first video, okay? And the client lifts up, okay? And she actually says to me, I feel it in my low back, okay? And Number one, I shouldn't have had this under her head. We should take that little blue pad out. I was just realizing that now. But number two, we should be, when she's lifting up, she's feeling it in her back. Okay, we're gonna watch this again. Okay, and I want you to watch her abs, and we're almost gonna see like there's like a roundness to the abs, like she's not keeping them connected. Okay, we can't see her low back, but she's not actually using her glutes and tucking her pelvis enough at the top. So the compression factor is happening right at that low back there. Okay, all right, let's go ahead and see when she did it right. I'm verbally cueing her in this video, but she is doing it herself. Okay. All right, there we have the top of the rib. We see much more flat. We see this line like here. And I asked her, like, are you feeling this in your back now? And she's tucking her pelvis under. She said, no, I'm not. I'm actually feeling it in my glutes here. And she started to say, my glutes are getting sore. This is a time for the clients to start to really feel their glutes, but you have to bring awareness that this is not meant to be felt in the low back. It's meant to be felt, you know, I like to bring awareness to the glutes and abs, but also the legs are also, you know, the quads are also working and hamstrings are working in this position too. Okay. So my point with watching this is, again, I'll show you this one where she lifts up and it's very subtle, but she is kind of a little bit rounder there and we don't see as much tone through the glutes. Okay. We'll go on to this one. And it's not like we see a ton of tone. She doesn't have a lot of ton, but we see much more flat and I can tell she is using it. But again, I'm using that verbal, asking her questions about that. And bridging is one of the most important patterns that I want you to start looking at with your client, because this is something that is a very foundational pattern that if they get it here, they will start to get it in other positions too. Okay, we're doing a kneeling hip thrust here, okay? A banded kneeling hip thrust. So again, we have Maggie here. We've got that extension. She's leaning the upper body back. Oftentimes we see people drive that pelvis forward in this position, so we're getting compression through that low back. Let's go on to this, which is actually gonna do it. And again, she's overemphasizing a little bit, but you will see a lot of the clients doing this, leaning back, pushing their hips forward, and sometimes even further forward than this, okay? That is not the way that we want this exercise to be performed, okay? So here, we're going to come in and she's doing it wrong. I'm going to cue her to be more tall. I often say come tall instead of like back. Okay. And I want her to think again, tuck that pelvis under at that top of that kneeling hip thrust and keep that rib cage connected down. Okay. We also want to make thing is if the band is too heavy, the client will automatically go back to more of this pattern here. Okay. So you have to find a band that fits what they are, fits their body. Okay. All right, let's go on to our next video here. All right, we're doing our RDL here. Again, you're going to see this. You can see it with kettlebell swings, things like that too. Let's watch this video. Okay. And again, we actually see that rib flared here as she's doing this and she's leaning back. All right, let's go into our correction. Pause this one. Yeah. And then she leans back. So we're correcting her. Tall, rib cage connected, hinge at the hips. Good. And then again, she does it again. So we correct, and you often see them do it. So I might have multiple corrections in one time. And I want her to think tall, not back. Okay. Again, what am I saying? Just like bridging, abs and glutes. At the top, think tall, abs and glutes. All right, let's go on to our next one. Okay, deadlift. Similar to the RDL, just going to the ground in this position. Okay, down, up. And again, this is an extension pattern. She looks great in terms of no massive flexion of her spine, but she tends to extend and have that rib flare. Okay, here, coaching it again. Okay, I'm telling her to start actually by engaging that rib cage. She does it. We connect the rib cage again, squeeze the glutes, the top. Release back down, hinging through the hips. Good, think tall. So she did a better job of going tall. She still needs a little bit of that rib cage cue for this position. All right, on to our next exercise here. All right, so now we're gonna start looking at the upper body and shoulder flexion issues, okay? Actually, guess what? We're gonna go back to our bridging for 1 second. I'm gonna take you back for 1 second. I wanted to bring this up. When she lifts to the top, we still see, you know, she has, we'll do this one here. She still has, she's more of a straight line, but she still has a little bit of that arch there. That's because Maggie has really tight quads and hip flexors, okay? So this is part of what is restricting her in this position. She actually actively controls it really well, but her quad tightness is something that we would address. For her, it's a movement control or a movement pattern that we're addressing, but then we also need to go back and look at some of those soft tissue restrictions. All right, let's get going back to our upper body stuff. Okay, back to the shoulder. So we're going to talk about this again. Is it a movement pattern issue or is it a muscle mobility restriction? Okay, so in this case, you can figure it out in other ways, but what would be restricted in pulling her body up into extension as she flexes the arm? The lats. The lats, if they're tight, they will pull the body into extension. We also have to though figure out, like, are they limited by lat length and then they're going back, or do they pull through their back first? So you're watching for a few different things here. Okay, so let's watch her here again. We have that extension moment in the back. Okay, she's doing it the bad way. Okay, so she's going up and then pulling back in that position, just kind of giving into the extension. All right, so I'm going to cue her here, cueing that rib cage. We see she is tight through her lats. That's the end range of her, like there. Okay, so I'm cueing her rib cage, and then I'm also cueing her to stop her motion where the end range of her lat is, okay, so that she doesn't go into excessive extension in this position. All right, let's look at a Latin press, or this, you could also take this, could be an overhead press and another, a dumbbell overhead press or something like that. Here we have again that extension pattern, again looking again at the lat versus, like, are they just using their power through their low back? We're gonna watch Maggie do this. She bends down, she extends through her back. So this one really looks like more to me in this position of a motion where she gonna like uses her back to lift her arm there. Okay, so let's go on and cue her here. So I've already connected her rib cage. I'm having her reach forward and think tall, and then she's actually able to get a little bit more as she leans forward into and extends through, but she's keeping that nice rib cage connection. We add on a little bit of a push into this position and then leaning into it, getting that nice long line of the body in that position. But really it's the rib cage that I'm thinking in that position is connected down. And then we're looking and considering her lat length. All right, upper body, overhead squats, overhead press. There's a couple different things in here, but we see this overhead squat and we see this massive extension. Again, is it the lats pulling her into extension, or is it a motor control? Okay, or is it her hips too? Hips can be an issue with this one too, that we're not able to open the hips and drop down low enough. So we arch to kind of gain motion in that position, or anteriorly tilt the pelvis to gain motion. So here we have an overhead press where she just kind of shows that extension position of the back, kind of using a little bit more of her back to kind of gain that. All right, here I'm coaching her, I think, through like more of that overhead squat position. We connect the rib cage, arms are tall, and then I'm keeping her really connected. This was really, really hard for her actually to do this, okay? And with this motion, I want her to be a little bit more upright. She hinges a lot just through the hips kind of coming back instead of more upright, but she does keep more of that connection with her rib cage, which keeps her out of her back. Watch that one more time there. Yeah. And I would prefer her pelvis again was being more upright, but we're working with what we have right now there. All right, let's go into our next one. Okay. So this is a low back extension pattern with both lower body and the upper body. Here, we're back to our classic bird dog. I know many of you may know this exercise, okay? It's a combination of the shoulder and the hip. So both of these can be contributing to what's going on at the low back, all right? And again, it could be a right lat length issue, a left quad hip flexor issue, or it could be a movement control or a combination of both of those things. So let's go ahead and watch Maggie moving the wrong way here. And again, she's going extreme, but you see your clients doing this, okay? So there's her pattern there. All right, we're gonna come in and cue her. So I really like my clients to think the leg comes out from the body and not up high. We wanna keep more of that sensation that the rib cage is connected and we're drawing our belly button up to meet our spine. The leg is an extension of the spine. It's not going up high for this exercise. Sure, are there cases where we're going to get into extension? We're going to strengthen the back into extension. We're going to lift those legs higher. There 100% is. But in this case where the client is dealing with low back pain and you're trying to teach them a better balance between the back muscles and the abdominals or the front muscles, we want to limit how high that leg is going. Okay, now we're going into lower body, upper body. We're going into a superwoman position. Okay, so I've written down providing a pillow pad under stomach or low back region to minimize extension of the spine. If somebody's having pain with lifting their arm and leg, we put a pad in. I'll show this later on. Okay, but here we have Maggie. Again, she is tight through her lats, then tight through her quads. So we see this extension pattern. Okay, let's watch her do this. And she is going a little too high, particularly for the shoulders, but we also see a little bit of rotation coming in this pattern, which can also contribute to low back. If the shoulder can't lift straight up, oftentimes the body will rotate to try to get the shoulder higher, which can also contribute to low back pain there. So let's go ahead and watch her, but we've put a pad in this case under her to get her a little bit more motion for her hips and her shoulders here. And down to this one. All right, and again, I want her just to think that she's barely hovering those arms and legs off the mat. Sometimes I have the arms go a little bit higher, but when we do this, we're working the low back muscles. But we shouldn't feel extreme tension through the low back as we do our superwoman exercise. We should just feel like there's some fatigue through that region, not excessive compression or pain or work through that area, just some gentle fatigue, and we're moving through the arms and legs. I also, in addition to having that pad under this, I often tell people just actively pull your belly button up to the spine. It's going to be a little bit hard, but just think about that as you're doing this exercise. Okay, let's go ahead and go into rotational pattern for low back extension pattern with rotation. All right, this is Isaiah, another awesome team member. He is doing a rotational press using a med ball. So we're going to go ahead and do this here. Okay, this is a little more tricky to see. Okay. But in this position, I'm going to go back to, let's see if we can go about 3 seconds. Actually more about here. Coming in, he drops the left shoulder. So this is, I say extension because the primary position at the end of the motion is extension, but we also see, instead of a pure plane rotation, we see a side bend into the motion and then an extension come out of it, which can really hurt somebody's back if they already have low back pain. Now, is this a pattern that is used in other sports and things like that? Yes, but when we're dealing with low back pain, we may be training them out of it in the short term and getting into better positions in the long term. Okay, we'll just continue to watch him. Again, it is more subtle. Come to his end range position here. And we have a more upright body. We have a little bit more. This doesn't look like excessive extension, but it's a more extended position than the next one that you'll see. We'll watch that one more time. All right, let's go ahead and watch this one here. Okay, we see that shoulder stay level as he comes across. Stay level. And he has a much more straighter spine in that position. Okay, I shouldn't say straighter. That's not the right word here. It's just he's getting more abs here on. So it's keeping that back more upright versus pushing into extension to gain his power. One more time watching that one. Push through shoulders. He doesn't drop that left shoulder down. He pushes straight through. And obviously the hips should be doing a lot of the work too, pushing off that back leg to create the power up the chain through the body. Okay, let's go on to our next one here. Okay. All right, so we're going to look again back to bird dog. So there's a different way to look at this extension pattern or flexion pattern of the back. So we're going to break this down here and call it hip disassociation. So meaning, can I move my hip? And I use the arms here, but really we're going to be looking at the hip here and the pelvis. Can I move my hip and keep my hip centered in the joint without pulling the pelvis as I move the hip? So let's see here in this position, the hip has pulled the pelvis into more of an anterior tilt. Okay, and I don't know if you see my cursor there moving. Okay, the picture below it, this shows actually when the person draws the knee in, the hip has pulled the pelvis into a posterior tilt and caused some, lumbar rounding or flattening in that position. Okay, neither of these positions again are bad unless they're excessively or repetitively performed. Okay, so let's look at this one again. She extends and the hip is pulling the pelvis up. Okay, and then as she comes in, the hip is making the pelvis round. So she is not able to keep a stable pelvis so that we have that ball and socket, and the hip, we want it to move in the ball and socket. I'm teaching her body how to move this way so that she can keep a stable pelvis. Pelvis drives anterior posterior is going to drive that back into extension and anterior tilt. It's going to drive the back into flexion and a posterior tilt or flattening. Okay, so here we're going to look at me doing a correction with her body. Okay, so this is back to that same video, but it's going to show again. So she comes in, she's being much more, this is her doing it the wrong way. I'm connecting everything up above, but in a minute, you're going to see me come in and we're going to go ahead and grab her pelvis and make her be stable. So I'm holding her pelvis and now I'm telling her, do not move your pelvis. Keep your abs engaged, but do not move your pelvis as your legs goes out or comes in. Now Maggie has really good body awareness, so she could easily do this, but there are a lot of clients that this is a really hard thing for them to do. So with all of my clients, I'm going to point out that I video all of my clients. I talk to them in the videos. I point out things in the videos so they can see it on themselves. They can hear me cueing it. I would highly recommend that you do this for your clients. Like if you find one exercise that you can video them doing it the wrong way, and then you can show them videoing them doing the right way with you cueing them into the right form. They can go back, they look at that, they think about that. Their brain thinks about that while they're sleeping, and all of a sudden this neuromotor connection, this brain-body connection starts to come into play. I don't know how many people have worked on this, not just for back issues, but for hip issues. Like the ability to be able to disassociate your hip from your back will help you in both ways. Okay, so my advice though regarding the video, your clients, if they see it on themselves, all of a sudden it clicks in their brain and they start to understand a little bit better how to do the exercises, but why they are having some pain. And I know all of us, majority of people here are not physical therapists, but as a coach, as a movement professional, as a Pilates instructor, as a personal trainer, you can make big changes in these people without having all this additional medical knowledge regarding physical therapy or rehab type things. You can look at them, you can make changes. All right, let's move on. Okay, this is another hip dissociation exercise, and this one is down dog, okay? So we're gonna show her doing this wrong, and I'm gonna talk to you about why in somebody that has back pain or somebody even that has hip pain, this is not the most ideal position. Okay, she goes back, and Maggie, again, is not as hypermobile as some of your little yogi, flexible people, hypermobile people. But she does come into this position, and instead of really opening through her hips here, which is what we should see in more of that down dog position, we should see more of a V, she's opening up through her low back and keeping her pelvis tucked or rounded. Okay, so here let's go ahead and have me correct her in this position. So she's going to push back, doing it the wrong way. We see a little bit of rounding through that low back, and I'm going to make her get into more of you might consider it an anterior tilt, but it's actually a tilt. I'm talking about those glutes being wide, the sit bones being wide as she lifts up so that she has this nice long body. We could have a little bit more like rib cage connection with her, but overall we want that position. Come back to here to be, and just pause it there. More of this V where we have a more straight low back. The hip is not pulling the pelvis into flexion. The hip is staying centered in the joint, and we're releasing through the glutes as we go up into that position, keeping this nice straight spine. People that have hypermobile low backs often do this and round through the low back in this position, or people that are used to tucking their glutes often do this. All right, let's go ahead and go into our next exercise. Okay, so this is going to be a different view. This is looking at how the hip and hip disassociation affects us in a different plane, okay? Let's look at this actual photo here first, up in that right top corner. We see as Maggie lifts her right knee, we look at her pant line, that what is she doing? She's not keeping that hip centered it may be centered in the joint, but the hip is actually being driven by, or the knee flexion, lifting that leg up, is being helped by the oblique. So we're getting this side bend of the body as she lifts her hip. Obviously, this is a little extreme. However, you will see this, and you will also see it more subtly too. But I often have people tuck their shirt in so I can see their pant line, so I can video their pant line and show them what this looks like. All right, so here's Maggie doing that. She's lifting the knee, and instead of just staying her pelvis level, she's just getting those obliques to kind of help like hip hike her leg up. All right, so this is a case where often the psoas is not doing as much of his job and we're getting more pull through the obliques to actually help try to get that leg up a little bit higher. So is this a hip mobility issue or is this a movement control issue? We would have to figure that out. But by starting at the movement control or that movement pattern, you can start to train somebody how to move better for their body. Okay. All right. So I'm here and I'm having her and I'm telling her to keep that pelvis level. I'm holding her pelvis down. This is actually one of Maggie's challenges. She does better on this side. Okay. And then she's going to do that right side again. She's lifting that right knee up. You can see she does have a little bit higher on that right side. Just a couple things to point out for a little extra information. It's not necessarily regarded to two things here. This hip is actually not accepting enough load. So her glute med on the left often is not as stable. So her leg doesn't feel as stable when she stands on this leg. So we help by leaning to her leaning to her left. And then accessory, often the right deep glute might be tight. And so that head of the femur, that ball might not drop down in the socket and the obliques try to kick in and help that hip. All right, a little more knowledge that maybe you wanted to know, but it might help you kind of think about why things are happening or how they're happening. All right, let's look at this one from the side. And again, with that cueing, actually, sorry, let's go back to this. With the cueing with this, I really am just thinking, try to keep your pelvis level. And sometimes I'll have them put their hands on their hips and then float the knee up, thinking about staying just the hip centered in the joint, not lifting with the obliques. Okay, now this shows from the back, the knee is lifting, but we're getting a little bit more rounding. You see it in her back. As she lifts, she actually rounds through her spine. We don't want that, again, excessively. Again, here and there, no big deal. But if this person is always doing this and they have low back pain, it is a movement pattern that we need to address. Okay, so again, I'm holding her pelvis. She may not be able to lift her leg as high. She may not have the range of motion in her hip to lift as high without affecting her back. That's where we would go into more hip mobility drills to start to open up her hips a little bit more. But again, the movement pattern and retraining part is just such a huge part of even a starting point for them. Okay, let's go on. Okay, so this is low back. I'm just going to give you two small patterns that I really pay attention to with people. Can you use your abs without squeezing your glutes? We're often taught in workout classes by physical therapists that when we engage our abs, we want to flatten our back. Okay, that's not the way that I like people to think about it. I want them to think that they're drawing their abs down to meet their spine in this exercise, and they are not using their glutes. Even when somebody does a modified crunch or something like that, the glutes are going to come on to tilt a little bit. But if their first motion is from the glutes, tucking that pelvis under, then we want to get out of that pattern of always using our glutes to engage our abs, because we'll start seeing it in hands and knees position. We'll start seeing it other positions, standing positions where we say abs and the glutes kick on, and we don't want glutes and abs to always work together. Okay, so here we see her. She's just doing big contraction, a big posterior pelvic tilt, which again, in certain cases can be relevant, but can she disassociate that abdominal contraction or drawing those abs down or just even bracing without having her hips, her glutes and hamstrings kick in to do that posterior pelvic tilt? Okay, so I'm actually going to make her come back, find kind of more neutral. You'll see there's a little bit of curve in her low back. Pull her belly button down to meet her spine, going to connect that rib cage, and then she could start whatever exercise she's going to do from there. Okay, that's really more watching patterns of glute squeezing when you're telling them to engage the abs. And I do crunches and things like that. I actually do them a lot to start working abs and to build abdominal strength. And then we progress in that. But don't be afraid of some mild lumbar flexion or mild lumbar flattening. It's just that when we get the glutes kicking in all the time, we want to break that pattern. All right, planks. Everybody loves planks, okay? But I see this pattern done all the time, okay? The one on the left, this picture, okay? She is a little too much thoracic flexion. In the long run, I'm not too worried about that, but she's squeezing her glutes again to bring on her abs, or she's been cued to always squeeze her glutes. So this in some people is okay, but in other people, not Maggie's necessary case, but in other people, we start to see like too much rounding of the low back, or we start to lose the ability of the low back muscles to work in a plank. I'm going to have you see her position. You're going to look at it and think it looks a little crazy. It's not straight, but again, she is tight. Okay, so she does the bad position. We release to her neutral position, okay? All right, that's her neutral spine where she can maintain that. Let's go back. I'm gonna pause it and bring it to the end and just look at that position. Again, Maggie has got tight quads and hip flexors, so you're not going to see a perfect straight line, okay? Why do I like people to do the plank this way and not always squeeze the glutes? Because when we are in a neutral spine position, the little tiny multifidi of the back are working gently, okay? We shouldn't feel like we're compressed in our low back or that our butt is sticking up in the air or anything like that, but we can have some work through our low back. We can have the little multifidi work in this neutral position, okay? Versus when we squeeze our glutes, we're flattening our back, we're turning off the multifidi, which are the little stabilizers of the spine. Again, it is based off the client and the client's presentation that we are kind of starting to look at it. But the more you start to look at your clients to realize when they're having their pain or what patterns do they always do, the more we can start to figure out getting them out of their back pain. All right, so takeaway number 3 from my story was that the body has the capacity to repair itself. The body has the capacity to heal, regardless of what the MRI tells you, regardless of your age, regardless of lots of different things. Okay, my client Jessica, she had gotten that MRI. The MRI showed some moderate arthritis in a few areas at the age of 38. Now, that scared her. It really scared her. It made her depressed. I had to take away that fear from her by telling her, look, your MRI is not you. Yes, we can't get rid of your arthritis that shows up, but we can change the way your body moves and the continued buildup of compression, which is causing the arthritis. We can also, through mobility work, through some of our exercises done properly, we can start to lengthen your spine and create more room between the vertebrae, which means that arthritis is not going to pinch on each other. It's not going to be compressing, and it's going to just get that length, and you're not going to feel that pain. So everybody's MRI, as many of you have heard, we can have an MRI that shows significant arthritis. The person can have no pain. We can have somebody else that shows nothing in the MRI and they have a lot of pain. So don't base your pain off of an MRI, and know that given the proper tools, whether that be physical therapy, whether that be strength and conditioning, whether that be nutrition, sleep, all those different things, the body has the capacity to heal itself. Okay, so I want everyone to close their eyes, and I want you to imagine that you have a client. We're going to call the client Joe. And Joe has had chronic low back pain. It's not too bad, but he has days where he misses. Let's say he's a member of your gym. If you're a gym owner or a gym, or a coach or personal trainer, he has days where he's been missing classes because of the back pain. My back hurts. Or he comes to class, but he says, I can't do that exercise. I can't do a lot of these exercises because it's going to hurt my back. And it's one of those situations where he started to gain a little bit of weight because he can't do some of the more higher level strength things. So he's not gaining as much muscle, or he's not able to do some of the cardio or plyometric things. So he started to gain weight. He started to become a little bit more depressed. He's just not sure of himself. Now, I want you to imagine 6 months later, and Joe comes to you and Joe says, you have changed my life. And I want to repeat that. Joe says to you, you have changed my life. So I'm going to tell you that this can happen. All those things can happen as you start to pay attention to what your clients are doing when they're exercising, when they're moving, okay? If you start to watch, instead of giving an exercise and thinking a bridge is a bridge is a bridge is not just a bridge. A bridge is different in every body. So the more we start to watch and pay attention to how somebody's moving, the more you as a coach, as a Pilates instructor, as a personal trainer, as a physical therapist, will start to see different patterns in these clients, and will start to realize, oh, I can coach them in a way that is going to help their back pain, or is going to help their shoulder pain, or some other sort of pain. So think about this. Do you want to be the practitioner, the coach that just gives somebody an exercise and gets on your phone, or gives somebody an exercise and then starts talking to another coach? Or do you want to become the go-to coach, the go-to Pilates instructor or physical therapist who sees things differently than everybody else and can make changes in your client? That you have a client that comes to you and says, you changed my life. That Joe comes to you and says, I can now do more exercises. I can now I can come to every session now. I don't miss classes because of my back pain. I can now lift my grandkids up. I can now get out of this depressive cycle. I've lost weight. Who are you going to be? Are you going to be that coach that looks at some of the stuff and corrects some of the stuff? Or are you going to be the coach that spends the time to really look at what is going on? Be the coach that pays attention. So I want to say thank you to everybody for being a part of this presentation. I really appreciate your time. You, just by being a part of this Recovery and Sleep Summit and watching this video, are that 1%. You're the one that's out there. You're doing it. You're getting more information. You're learning about what is going to change your clients' lives. So a big thank you to Nick for putting this on and for also putting on the Impact Speaker Academy, which I am a part of, and to everybody that helped out with the Recovery and Sleep Summit. I think it's such an important thing to have these free resources that allow us to learn and also allow us to gain some credit for some of our continuing education, okay? So thank you again. It is such a blessing to all of us to be able to have this. Thank you to the physio team, to Maggie, Isaiah, and Vichar. Vichar wasn't in my videos, but he was a big part in helping me put together this presentation. So thank you. And thank you finally to my family for putting up with me while I have spent countless hours like doing physical therapy, coaching clients, wanting to learn more, taking classes, and also putting this presentation together. All right, so contact information. If you have questions, feel free to email me or send me a DM. I am on Instagram at PhysioBeckyRucker is my personal / what's my business page for me personally. And then our company Instagram is at Physio Movement and Performance. And then email Becky at physiomovementsandperformance.com. I appreciate your time so much. Again, if you have any questions, feel free to reach out. I love talking to different people. It's just been such an awesome part to be a part of this. Thank you.